I'm the chair of the Health Services Committee, and this will be the third presentation of what to do when you go to the hospital and you return to Cedarfield to make it as smooth as possible. We do have more handouts, so if you raise your hand, somebody will come and bring them to you. And then I would like to thank all the people from administration that are here. We have Lauren Burnett, who's the Administrator of Healthcare. We have Emily Hicks, who's the Social Services Manager in Healthcare. We have Melissa Ellison, who is the Social Worker for Independent Living. And we have Jackie France, who is the Director of Nursing. So I'm going to turn this over to Lauren, and hopefully this will be informational for all of you.
Okay, good afternoon. Again, my name is Lauren Burnett, and I'm the Administrator for Health Services. So here to provide a little bit of information and a visual to start, and then we'll take questions and answers during the second half of this. And keep in mind, this presentation in particular is geared towards independent living and what happens when an acute incident might occur within your apartment or cottage. So this really applies to that process, okay? So I wanted to start out with a scenario that could happen to any one of us, that at 2 o'clock in the morning, let's just say that you have a fall in independent living trying to go and get something from the kitchen. You're not near a phone, so what would happen in that scenario when you've had a fall, it's an acute incident, and you're in pain? What would you do? Great answer. That's the first thing that I have on here. Utilize that pendant that I hope you all wear, because that system alerts the team here at Cedarfield that you need assistance. So pretending this is after hours still, the clinic's not here and open, our nurse supervisor is here for the whole Cedarfield campus. So when you press that pendant, it is alerting that supervisor who's here, in addition to a security officer up front, that you need assistance. And it could be that the supervisor does attempt to call you at first when this happens, because there are accidental pendant presses that do happen. But of course, if you don't respond, this is going to trigger the supervisor to come and do an assessment and to check on you to make sure that you're okay. So next, they arrive at your apartment or at your cottage, and they're going to assess to see what's going on. Does this require a trip to the emergency room? So for the purposes of this presentation, it's going to. You're going to be sent out to the hospital by the nurse supervisor who has responded, with the security officer assisting. And they're responsible for ensuring that documentation goes with you when EMS arrives. So that means any advance directives you have, if a DNR applies or a do not resuscitate, all of those documents would be sent with EMS, so you don't have to worry about coordinating that in the middle of an emergency event, okay? What's next after you have been sent out from Cedarfield? It could be one of two options. You arrive at the ER, and it could truly just be an ER-only visit. So you're assessed by the nurses and the doctors at the hospital. They don't see any reason to do an admission overnight or anything long-term, meaning you'll be coming back to Cedarfield in less than 24 hours. In that scenario, the hospital is not responsible for arranging transportation. That's on you as the patient at the hospital. That's not to say that there are not transportation options available to you. It's just up to you to help coordinate that. So, and you'll see this on some of the card handouts that you have on who to call, but really and truly calling either concierge here at Cedarfield or the nurse supervisor is an option as well, to tell them that you're being released, ER visit only, and need some help with after-hours transportation service. So that would be what you would do in that scenario, because the hospital will not help you if you're not admitted. Let me see. And then we do ask you, of course, if you have returned back home to independent living, to make sure you do follow up with the clinic team so they have the same information, the same documentation that you received during that ER visit. So that's one option of what could occur. On the right-hand side, what happens if you do go to the hospital and they determine, yes, we need to admit you for X amount of time? That is when you get assigned a case manager. So when you are officially admitted as a patient of the hospital, you automatically get assigned a person, a case manager, who will be responsible for helping to coordinate your discharge back home or to whatever is necessary. That person connects with Cedarfield to make sure we're on the same page about the timing of when they're looking to discharge you and what level of care is recommended based on the hospital's assessments. So we do have a liaison, if you want to look at it that way, between the hospital and Cedarfield. And again, I mentioned the hospital will help determine what is the most appropriate discharge plan. So it could be that it truly is returning home. Maybe you need a little bit of home health, nothing too serious. Or it could be there's a fracture that's involved that's going to require rehab services in our healthcare side of Cedarfield. Regardless of what the recommendation is, we're happy to coordinate that. And that's really what that discharge is looking like. In this scenario, because you're admitted to the hospital, that case manager is responsible for coordinating transportation. That's not directly on you as the patient. So that's the differences to kind of compare and contrast what we're looking at based on what happens at the hospital. So now I would like to introduce you to who these case managers are talking to at Cedarfield. In the front of the room, this lovely lady is Michelle McNaughton, who is our new healthcare admissions coordinator. So that's why she's not in the Q&A quite yet, so she's still new and learning Cedarfield. But she has an office right at the healthcare entrance on the left. This is her contact information you can see on the slide. She'll certainly be around after to meet you, take any questions, but this is the person who is connecting with all of these case managers that we're talking about when you're admitted to the hospital. Okay, thanks, Michelle, appreciate it. Okay, so now I'm gonna pass this over to our Director of Nursing, Jackie France, to do a little bit about what happens if healthcare is the recommendation and that's your plan for discharge.
Good afternoon. So what happens when you arrive in healthcare? A Cedarfield team, which consists of a CNA and an RN, typically, will assist you to your assigned apartment located on either Poppy Place or Lavender Lane or Magnolia Meadows. So what are they going to do after they introduce you to your temporary or future apartment? They're going to want to assess you. And that means they're going to check you out from head to toe. So if you come shy, you won't be shy by the time you leave. But of course, you're coming from the hospital typically, and they've already broken you in, so you should, you'll have no problems. They're going to get some vitals on you. They're going to introduce you to the room, where it's pretty obvious where things are located in the room, but things like the remote control and how to use it. Once they do an assessment and they orient you to the area, they're going to go and look at the documentation that you came with, which typically involves orders of what the hospital is recommending on discharge what you should continue or start with. Then our providers, Dr. Shear, Dr. Cook, or Arden, our nurse practitioner, reviews those medications to see if they are in agreement to it. They will then give the nurse approval on either all or some of the medications in your discharge paperwork from the hospital. Okay? Rehab, whether it's PT, OT, or speech, will come and assess you within 24 hours of your arrival to see what you're appropriate for as far as therapy is concerned. I don't know how many of you were here last time we did a similar presentation, but I said something that some of you have caught me in the hallways and said, oh, she's the one who said, I'm only the messenger. I'm getting ready to tell you something yet again that I'm only the messenger on. Because Poppy Place, if that is going to be your temporary stay in healthcare, it's a regulated household. That means CMS gives us our rules and regulations that we must go by to be considered compliant. So you cannot bring your medications, nor can we use them if you do. We're going to give them right back to your family or whomever can put them somewhere in a safe place, because by regulations, we cannot use your medications. It doesn't matter if it's a brand new bottle that the CVS pharmacy just gave you because you went and filled it before you got to Poppy Place. It doesn't matter if it's an unopened, over-the-counter Tylenol container. We cannot use it. Once we get those orders in that I was just talking to you about, provided what orders the provider approved, those orders then go to Remedy because they're in our electronic system. Remedy is our pharmacy that we use, so that's where the medications will come from. The nurse or the supervisor who is on that particular shift the day that you are admitted on Poppy Place or in other areas of healthcare will call the pharmacy, talk to a pharmacist to get confirmation. Number one, you do see the orders in PCC, which is our electronic system that we use here for charting. They'll confirm, yes, we see them. And then the nurse will ask, can you confirm if it's going to arrive on the next delivery? Our delivery schedule is between midnight and 6 a.m. every day. Once that confirmation is received, we are under the impression that your meds will be coming during that time frame on delivery. If it's something that you need, for example, pain medications, unfortunately, we don't have your medications here by the time you get here. So we do have something called a stat box that we can go into, provided we have the order for that particular medication that is in the stat box from the providers. We can't just go in it without following certain processes, and one of them is we have to have an order. Again, please, pretty please, don't bring your medications from home. Don't use your medications from home, because we'll be giving you medications, and if you're taking things without us knowing that, that could really put you in an unsafe situation. Please. Okay, who's next? Lauren? All right. And I didn't do the,
We're going to take questions after the presentation portion is over, so just hang on to that and write it down if you've got something in mind. Thanks. Okay. Oops, it was there. Okay, so now that we've talked about what to expect, I know a lot of questions are surrounding who pays for it and what does Medicare, encompass and things like that. And ultimately, it depends on how long you stay at the hospital. In order to utilize the Part A portion of Medicare, which is what we call skilled nursing, that requires 3 midnights at the hospital. And that's not to say that you arrive at the hospital, let's say at 11 p.m., that doesn't automatically mean that counts as the first night, because they could keep you in observation in hospital terms and admit you at 1 a.m., let's just say. So for Medicare, to qualify for Part A, you have to have 3 midnights of being considered admitted to the hospital. There are 2 different types of Medicare insurances that most people have. One of them we refer to as traditional Medicare, and the other one we consider managed Medicare. So that could be a policy through Humana, for example, or United, companies like that that's considered managed Medicare. And the reason I put this up here is managed plans like Humana do require a prior authorization from Cedar Field. So that's what Michelle is helping to do on her end in preparation for you needing to come for rehab under skilled services. But it does require an extra step with the insurance company to get that approval ahead of time. So it's an extra step in the process. What is included if you are coming under skilled nursing Medicare A is really and truly most everything. So that's the apartment in Poppy Place that you're staying in, all the meals that come with that, the medications that the doctors order that comes from Remedy Pharmacy are included in this. All medical supplies, therapy services, transportation to your appointments is something I didn't mention here. It's all encompassing for Medicare A. Now, that's not to say that you as a resident still have an emergency situation that sends you to the hospital, but maybe it doesn't require 3 full nights of staying there. You still have access to healthcare services here at Cedar Field. It just won't be under Medicare A. So then we turn our attention to Part B. So that's how we would run your insurance coming to healthcare. And you still have access to rehab services. It's just a different way of looking at the insurance. So therapy services are still covered under this Part B. However, your medications are out of pocket. Medical supplies that are being used for various reasons are out of pocket as well. So it's just a different structure as far as who's covering it and what it looks like. Now, continuing with that thought process for Part B, it will look different depending on your Cedar Field contract. So don't think about Part A. We already said that's all encompassing. If you're here in healthcare under Part B, it will look different based on your Cedar Field contract. So life care residents, you have that apartment included, and you have meals included. So there's no additional fees. You're still paying that same monthly rate that you're accustomed to with the added therapy services for Medicare, but you're still paying for your medications and your supplies. Now, if you do have a preferred choice contract, you're having to pay for that stay in healthcare because all Medicare is paying for is the therapy services that you're receiving. So that's the daily rate that currently stands at $510, and that does increase with the fiscal year, similar to your rate increases. So right now, it's $510 per day. So it looks a little different if you're under that Part B. That's about as, I know it's a convoluted subject when we talk about insurance, so I'm more than happy to meet individually on what this looks like, but this is a broad overview of what is involved in getting you to come to healthcare. Now, that being said, we've been talking about emergency situations that you're not planning for. What happens if you have a procedure at the hospital that you're aware of? Something like knee replacement, shoulder replacements, things along those lines. We want to know about them is really the first thing to state. Who you would connect with is actually here with us today, Melissa, over at the table. Your independent living social worker is a great point of contact in addition to the clinic team to be able to tell them, by the way, on May 1st, I'm going in to Henrico Parham, for example, to get my knee replaced. And I'm expecting to stay one night and I'll need to return to healthcare. That's the information we're looking for to be able to plan ahead on our part, to the behind the scenes work. So it does involve reaching out to your clinic team to tell them the date and what's happening, what the plan is. The clinic team and Melissa are then coordinating with the health services team that's sitting here. So we're very aware of the dates and what to expect. And we're happy to meet with you ahead of time. Some people do wish to, do a little bit of a tour to help plan. That's perfectly fine. But we want to know about it so that we can make it a smooth process. And then if you have questions ahead of time, they can be answered. What makes it challenging is when we do have residents that have a planned procedure that the team here at Cedarfield is completely unaware of. And then we're hearing at the last minute, oh, I'm at the hospital and I need assistance going to health services. And we can accommodate and we try our best to, of course, care for every Cedarfield resident. But planning ahead is helpful if it's something along these lines that's a scheduled surgery and not an acute incident. So just keep that in mind. Okay. So hopefully that's a good overview of what happens from point A to point C. We're going to be here for the rest of the time over at this table taking questions, and I will have Michelle, our admissions coordinator, coming around with the microphone. So just give us a minute to get there. Thank you.
Can you hear me? I'm repeating myself probably from the last time we did this, but one of my biggest concerns is my medications. And I just updated my vial of life with very specific instructions on dosage and when to take and so on. But that apparently isn't going to do any good in this instance. And you were talking about orders. If I'm in the hospital and I come back, you're talking about orders for meds. But who's going to order those things? I have a regular set of meds that I'm not allowed to take, I'm not allowed to bring. You guys aren't going to know what they are, and I don't know who's going to order them. I still think, and also, I've heard some disaster stories about people not having pain relief or their meds for more than a couple days. So I'm very concerned about how we get our prescriptions at the right time, the right dosage. Sorry to be repetitive, but it's a major concern.
Thank you for your question. When you come to us from the hospital, they provide a list of recommended medications. Some of them will be medications that you may have been on in the hospital and they want you to continue those, or there may be something new. As far as what you're used to taking, sometimes those medications will continue, but please know that is a provider decision. That's going to be Dr. Cook or Dr. Shear or Arden, the nurse practitioner, to make that decision. If you are concerned about your regular medications that you're currently on right now, you would want to be sure to speak with Dr. Cook or Dr. Shear or Arden. I don't know if you see them in the clinic, but really that is the provider's decision to continue those medications or not. And the nurse follows what the provider has instructed, which we know is an order. Correct. Just like the providers in the hospital are not your providers when you go to the hospital for a surgery or for something else, typically. Again, it's up to the provider as far as what medication you're going to be on or continue on. Dr. Johnson, you wanted to add something?
Okay, I'm going to put on my MD hat right now. So, if you come to the hospital, one of the principles is to make sure your vial of life comes with you. So, if you're a Parkinson's patient, or you're a seizure patient, or you're a cardiology patient, the hospital in the ER or on the floor will have a list of all of your chronic medicines. Unless you were put nothing by mouth, some of those may be changed to IV while you were in the hospital. But the hospital will know, and most of those medications would be continued in the hospital. If while in the hospital, say you have something going wrong with your heart, and a cardiologist comes in from a group that you use, they may change your medication. So the medications that would be then sent to Cedarfield may not exactly be what you were taking prior to going in. But the list of all of the medications that were given in the hospital will be provided on your discharge summary, which is why one of the things in the handouts is make sure you have a copy of your discharge summary, even though the hospital will be faxing it to Cedarfield, but you have a hard copy in your hand. Usually at the time of discharge, the nursing staff at the hospital will go over every medication you were on. And I want to add something about the stat box. You can shoot me now. But in addition to pain medicines, it's my understanding there are over 100 medicines in the stat box, many of which are commonly used medication like blood pressure medicines and different things that even though there might be a delay, they have something that can fill that void. And if it's something really unusual, like a strange seizure medicine, if Remedy has it, they can ask for it to be delivered stat, correct?
Which isn't in 5 minutes because they have to deliver it. We're talking 2 to 3, 4 hours, 2 on average per Heather from Remedy.
Okay. I'm concerned that if I end up under Medicare Part B with medications, don't mean to kick a dying horse, but I get my meds from the VA. There is no way that you're going to get the medications from them in a timely fashion to be able to take care of me. So what do?
In that scenario, I would call Heather and see if we can get Remedy to communicate with your pharmacy, have those meds sent to Remedy, and get them repackaged so we could get you your medications.
But I'm talking days of not getting those medications.
Okay, I worked at Patient First Urgent Care, and anybody from the VA could come see us on the weekends or in an emergency situation. And there are pharmacies that we were allowed to get a temporary supply of medications or the medications from that the VA policies all cover.
I get my VA services in Texas, so that's another issue.
Hi, everybody. Um, if For those of you who don't know me, I'm Heather. I'm the pharmacist. So another option would be also that Dr. Cook or Shear or Arden could put orders in for Remedy. We can bill the VA system for medications. So as soon as those orders are entered, they can go to their stat box and pull the medications for you. So it would be kind of the same procedure. And if they're on your discharge paperwork, I am quite certain that one of the doctors here would put an order in for them as well. And that we could do a stat delivery also for those if need be. But once you're in healthcare, they would visit you. So you would be assigned a doctor in healthcare.
Well, I would like to be assigned one before I get there, but they're not doing that. They've got a wait list. Yeah, I know you're frustrated.
Yeah, I'm gonna let you take that one.
So the independent living clinic and your availability to see Dr. Cook or Dr. Shear is different than health services. So we're talking about you having some sort of event that's put you in the hospital, and then you need health services afterwards, or health care probably. You would automatically have access to Dr. Cook and or Dr. Shear when you arrive in health services. So they see every single one of our residents, regardless if they're long-term or temporary. So the wait list you're talking about is on the independent living side. So you would absolutely be seen by one of those providers when you arrive in healthcare.
Do you have any choice of which one?
You do. They work together. They partner together because they rotate days on which they're here. So, for example, Dr. Cook is normally Monday, Wednesday, and Friday, and Dr. Shear's Tuesday, Thursdays, for example. So, if it's an urgent need that needs attention, it might be the other provider who's there that day that can see you. But ultimately, they work together in one collective group. So, what happens, with a visit with Dr. Cook, Dr. Shear's going to know about, and vice versa.
Could someone talk about the differences between admittance to a hospital and observation? A patient very easily could be in the hospital 2 days, but yet not be admitted. And if you could talk about that difference and what it means.
So a hospital admission is you're actually admitted. You usually can have up to a 24-hour observational stay. Say somebody goes in and has a cardiac cath, and the cath ends at 5 o'clock in the afternoon, and they're watching them, and they don't really like how they look. They can elect to keep them in the hospital on observation for 24 hours from the standpoint, the time that they decide that they want to put them into observation. That is not considered a hospital stay. So you have to be admitted to the hospital for it to be a hospital stay. And that's one of the reasons that I have said to other people, even if you're going in for just a procedure like a colonoscopy or a cardiac cath or an echocardiogram or whatever, something can happen. Let somebody know at Cedarfield that you're there. The chances are you're going to return the same day, but there's always a chance that may not happen. And then they would have a little bit of an idea where you were. But for Medicare, you have to be admitted. And technically, I have a hospital administrator over here. Usually an observation is a 24-hour observation, right? So, yes. Well, I think it's the same way as an ER visit would be. it would be the same way as an ER visit. If it's after hours, you can call the concierge, which clicks over to security, and they have contracts with some people that can help arrange transportation for you back. It would be a charge to you. It's
I have two questions about emergency circumstances. The first one is, so my husband and I live together. If one or the other of us has an emergency, can we initiate a call to 911? Okay, so there's nothing to say not to do that. Okay, second question, let's say that I'm being transported to the hospital by ambulance after one of these emergencies. My husband wants to come along. He can't ride in the ambulance, at least that's been our experience in the past. I'm not sure I want him driving over there at 2 a.m. in the morning. Is there any Cedar Field option for him to be transported to join me?
It would be a similar situation where, our nurse supervisor or the security officer could assist with connecting you with those after hours transport companies. So Cedarfield's transportation would not be here at 2 in the morning, for example, to be able to give him a ride to the hospital. So it would be a similar situation of coordinating that with those outside companies. And I think Melissa has something to add too.
I just want to speak to the first part of your question from an independent living standpoint. If it is an emergency, please call 911. If you think of it, also pull a pull cord in the apartment because that alerts our Cedar Field system that there's an emergency. I don't have to tell you how big this campus is. So if we know that it's going off in apartment 1, 2, 3, 4, 5, we can let security know. That way they let EMS know the minute they arrive on campus and direct them to the proper location.
I've got the mic. If it is a planned procedure, is there a way to coordinate with the case manager to get your, what I call your regular medications all queued up so they are ready to go?
We can definitely be in touch with the case manager. However, and you can make the provider where you're going aware of what your regular medications are. But please know it is the provider's decision. Correct. Correct. Say that again, I'm sorry.
If it's diabetic medicines that you would be taking regularly, odds are they're going to let you continue to take them.
Correct.
If those arranged for, then that's half the battle.
Correct.
And now you can hear me.
Yes. But just to be clear, until you physically arrive at whichever household you're coming to in healthcare, we cannot order anything for you until you physically get here. So it's not like you can call me and say, hey, Jackie, I'm coming because I got a knee replacement and I should be there by such and such a date and time, and I'm going to need you to have my meds ready for me by the time I get there. It doesn't work that way. I just wanted to make sure that that was clear.
A question about the 3 nights being required for Medicare to cover you in Poppy Place. But if you're a healthcare resident, you could come back to Lavender Lane or Magnolia Meadow without having to have 3-night stay. Is that correct?
Correct. So if you already are a resident residing, let's just use health services generally. It could be an assisted living resident, for example, that doesn't require skilled services and hasn't had the 3-night stay. It could be a situation where they return directly to the apartment they reside in, and that's perfectly fine. But ultimately, we do have circumstances where skilled nursing is required under that Medicare Part A, and it still requires that 3-night stay regardless of them living in healthcare or not.
So it makes no difference if you're life care versus preferred choice?
Not on what Medicare will cover, no. So regardless of your Cedar Field contract, Medicare skilled nursing services still require the 3 midnights in the hospital
Right.
as admitted in the hospital.
But if you were independent living and life care and you didn't have that, you could end up in Magnolia Meadow or Lavender Lane. if
You
needed.
could. So if you still require therapy services and a healthcare level of care and did not receive those 3 nights to qualify for skilled nursing, then Part B would still get you those therapy services. And under life care, you would not be charged for the healthcare stay. As a preferred choice resident, you would. Oh, hold on one second. We've got a couple of questions in the front, Michelle, just to let you know.
Most of the things, can you hear me?
You gotta hold it really
Most of
close.
the things that we have talked about, most of the things that we have talked about, there has been mention Monday through Friday, basically 9 to 5. I have had children, animals, and myself. I've never had anything happen between 9 and 5, Monday through Friday. Never. Okay, I'm a life care resident. That sounds like it's a start and a help. What in God's name do I do? And also, I have a different doctor from Dr. Cook and
So if an emergency situation happens after hours, that was the exact scenario at 2 in the morning, let's just call it a Sunday, 2 in the morning, that you have a fall in your apartment, what do you do? That's what your pendant and call bells or pull cords are for in your apartment, in addition to having that nurse supervisor. So just because the clinic is not open at 2 a.m. on a Sunday does not mean that we don't have a nurse supervisor and a security officer here on site. So the same people mentioned in this presentation would be responding regardless of the day or the time. So the process to the hospital would look the same. Now, that being said, if it's an admission to the hospital, I don't know, let's just say Friday night, you get admitted to the hospital. If you are looking to return to healthcare, and that's the recommendation, to return to healthcare under skilled services, we would be coordinating that piece with the case manager during regular business hours. So you would be in the hospital admitted for the weekend if they're recommending skilled nursing services. Now, if they just want to say you're fine to go home in that scenario, it would be coordinating that transportation with the nurse supervisor back to Cedarfield. Does that help? It doesn't change too much. Like exactly what was on this presentation is what would occur regardless of the day or the time. We have a nurse supervisor that is here after hours every day.
I'm aware of that. I have made that phone call before at 11 at night. An hour and 23 minutes later, the person called and came.
And that is not the expectation.
Okay,
I
thank
will
you.
say that. It should be certainly a faster response, or at least a call to try and field what's going on and
Okay.
what type of help is needed.
That helps.
If you have not been admitted to the hospital for the 3 nights, but you still need some level of skilled nursing, do you come back to Poppy Place if there's space available, or would you go to Magnolia Meadow or Lavender Lane?
When it comes to any short-term rehab stay, regardless if it's skilled nursing under A or B, our goal would be for you to come to Poppy Place. Now, that being said, if we, for example, have 1 room remaining in Poppy Place, but we have 3 rooms in Magnolia Meadows, and you're not having that 3-night stay, you're not coming under skilled nursing, then we would, in that scenario, move you to Magnolia, so we still have that Poppy Place room available for someone who needs the skilled nursing, because Poppy, those 20 rooms are the only rooms in all of Cedarfield that Medicare A covers. So It depends on availability, but our goal is Poppy Place.
Okay, thank you.
Sorry, I'm back to the dead horse. If you come back from the hospital and all your meds come back with you and you continue to take them, and then you need a refill, and you hear from the nurse 2 days later, gee, we still haven't gotten your refill for X drug, and you think, that's why I've been sick all night, I'm going into drug withdrawal. The next day she told me she was told, I didn't know by who, that it was a special order. Where do I stand with something like that? And we did go back to my apartment and get my drugs, and we used them.
So if there's an item that's ordered that Remedy doesn't carry, they can use a backup pharmacy like CVS and repackage it.
Is there a procedure that has to be followed to initiate that? Do you need like a doctor to go say, fill the special order, or are they supposed to do it automatically? Because it didn't happen. I don't like drug withdrawal.
Yeah. So if we don't have an item, we would try to call and let someone here know that we don't have it and set up a delivery from a backup pharmacy. That's the typical procedure that we follow.
It's okay.
I'm sorry to monopolize. I'm concerned about coming home from the hospital on a Saturday or a Sunday. And again, getting into this whole thing with drugs, you said that the doctors are available Monday through Friday. If I understood correctly, you're going to bring orders from the hospital that are going to address the meds, but the doctor has to review them before you guys will administer them. So what happens if we come home on Saturday and Sunday as far as important medications are concerned?
Outside of Monday through Friday and after hours and on the weekends, one of them is always on call. So the
Okay.
nurse will call, verify the orders, and they will say, these are the ones we agree with, these are not.
Even if we've never seen that doctor before?
For health services, if you're going back home to IL, that's going to, no?
No, I'm talking about if we're admitted, if we transfer to health services.
So when you're covering the nursing home and you're on call for 24/7, and Medicare gives you on the weekend 48 hours to physically come in and see the patient, but you can talk to the nurse can say, Mrs. Jones just came on, she's on A, B, C, D, E, F, G, and you can say, go ahead, put those in as a verbal order from me, and then you countersign when you come in.
Typically, we admit Monday through Friday. So unless it's some special circumstance while you're being admitted on a Saturday or Sunday, that would be the exception. But usually it's Monday through Friday.
Okay. Our experience is when the hospital says it's time to leave, you leave.
So usually if you've been in the hospital for a longer stay and they know that you're coming back to skilled care and you're coordinating through the social workers, they usually try to arrange all of that for during the normal week. It would be the exception rather than the rule, to not that it doesn't happen, but it's usually done that the majority of those are transfers are done Monday through Friday during the day hours.
Similar to Marty's drug situation, I also was released about 3 o'clock on a Friday afternoon, walked into healthcare. They looked at my list of meds and they told me at that time that one of my meds was something that they did not have in any box anywhere. and that they knew for a fact we were not going to be able to get it at all that night for me to take it at the time I was supposed to be taking it. And I just think y'all need to be aware that that does happen, just like with Marty's. Now, I didn't go through the suffering that Marty went through. We had a similar solution. I know you don't want to hear that, but you need to understand that we are going to have people come from the hospital at an odd time when they know for a fact Remedy doesn't have that drug, and they're going to have to go through another source, and they cannot get it in time for you to take it when you're supposed to. And y'all need to start thinking about what are you going to do then. I know what we did, and I plead the fifth. And the same thing occurred also with an over-the-counter drug I was taking by a doctor's prescription, even though it wasn't a true prescription, it was over-the-counter. So we had two situations there, and they knew for a fact it was not in their box, and they knew for a fact Remedy could not get it to them that night in time for me to take it.
So, one thing that I would like to add is if you are having a planned procedure and you have a list, okay, in that case, like, I don't really know what Remedy could have done ahead of time, but if there's a planned procedure and you know that you're going in for a knee replacement, something to that regard, come see me ahead of time with a list of your medications, because if it's something that Remedy does not carry, I can get them to order it so that they have it when you come back. Because if you're going to stay in the hospital for a couple days, I can work all that out. It takes a day to get a medication. If something's on back order, we can find the backup pharmacy ahead of time, just so that we know who to call when we get that order.
And that's why I'm bringing this up, because I'm talking about something not planned.
Yeah, in that case,
I don't expect answers right now.
Yeah,
I'm just
I don't-
saying, I know for a fact I lived through it. I did not go through what Marty went through. We found a solution. I'm sure it was not what you wanted to hear for a solution, and we had no issues, but we don't want y'all to lose any licensing or agreements or whatever with whoever. But y'all need to think about some of these things that are going to happen. You got a large group of people, it's got to come up.
Yeah, we can also send OTC meds in the daily bags to healthcare. We do that all the time. But I'm in the store downstairs every Monday through Friday. So if anybody is having a procedure and you have at least a week before it, come see me. I'll go over your list with you. I'll make sure we have it. I can't really address emergency situations so much, but I do think it would be good to be prepared ahead of time, especially for your regular medications.
If the three young ladies who have shared their experiences, I would like to see you at the end so I can get your name and the time frame. Thank you.
It doesn't look like there are any more questions, so I would like to thank everybody on the panel that came to help put this presentation on. They were all glad to do it, and I think they did a really, really great job. Thank you.
Real quick, I have some Poppy Place frequently asked questions handouts, so I'll put them by the door so that you can grab one if you'd like to take with you. If you don't get one, we're going to put some extra ones in the clinic. So if we run out or you don't get one today, feel free to stop by the clinic this week.